Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Today, 4th September, is celebrated as World Sexual Health Day. That's why we are doing a live on how sexual health can affect your quality of life. We often have idea that sexual health is related to some pleasure or maximum for procreation, that is for having a baby. Sexual health does not have any importance. This is the wrong idea often we are having. But remember, sexual health or rather sexual problems sometimes can represent some serious problems, and this can affect your quality of life as a whole. And sometimes sexual problem may be related to some serious disorders like heart attack, diabetes, hormonal imbalance, and even cancer. Therefore, it's important to give proper importance to sexual life. First of all, sexual problems can affect your psychological and mental health because you may feel depressed, you may suffer from depression, anxiety, bipolar disorder, various disorders. Therefore, it can affect your mental health. On the other hand, these mental health problems are going to exacerbate your sexual problems. Therefore, it's a vicious cycle. That is, sexual problem leads to mental problems, and mental problems again increases the risk of sexual disorders. Therefore, it's important to take care of your sexual problems, and if necessary, please don't hesitate to talk to your doctor, because you need to talk. You should not suffer silently. Next, sexual problems can affect your interpersonal relationship, the relationship with your partners, and even it can affect your professional life. It can affect your quality of life as a whole. Thirdly, for obvious reasons, sexual health can affect your fertility. It can affect your fertility potential. It can cause infertility problem. Simply because you are not having regular intercourse, it can cause problem in having pregnancy if you are planning for pregnancy. On the other hand, infertility itself can affect the sexual life because infertility causes stress, and this stress can again affect your sexual life. So again, this is a vicious cycle. That is, infertility causes stress, this stress affects your sexual life, and these sexual problems and again can affect your fertility. So therefore, it's a vicious cycle. Therefore, we need to break this vicious cycle by giving proper importance to sexual life. And believe me, sometimes we get to see patients who are coming to us saying that, doctor, we are unable to conceive, and later on it is discovered that they never had a single episode of sexual intercourse. Rather, they are pressurized by family and friends and society that they need to have baby, but they never had any intercourse. Therefore, we need to talk to the doctor. We should not suffer silently. Next is the biggest issue, the STI, sexually transmitted infection. Different sexually transmitted infections can have differing harmful effects on your body. Sexually transmitted infection can cause blockage in sperm conducting passage. It can affect the testicle, affecting the sperm production, and it can lead to infertility in male. It can lead to obstruction causing azoospermia. It can affect the testicular sperm production. It can cause also low sperm count and low motility. As a whole, it can affect your fertility potential. On the other hand, in female, the sexually transmitted infections can lead to PID, pelvic inflammatory disease, and this pelvic inflammatory disease can cause fallopian tube blocked, and that can cause infertility. It can affect the function of the ovaries, function of the womb, and it can again affect the chance of implantation, chance of egg production, and again it can lead to infertility. And therefore, sexually transmitted infection should be taken seriously and should be treated in proper time, because if it is delayed, if the treatment is delayed, the infection may be gone, but the harmful effects of infection may be there. That is, infection may be cured, but the obstruction caused by infection may be there, and it can sometimes cause permanent infertility. On the other hand, this sexually transmitted infection can cause chronic pain both in male and female. In male, it can cause chronic testicular pain. In female, it can cause chronic pain during intercourse, chronic pelvic pain, that is pain throughout the month, or pain during period, that is called dysmenorrhea. And in male, it can cause chronic testicular pain. And again in female, this pelvic inflammatory disease caused by sexually transmitted infection can sometimes cause painful sex. Some sexually transmitted infection like herpes can cause very much pain during insertion, during sex, that is sex simply is becoming impossible because of pain. And it can cause menstrual problems, can cause irregular periods, painful periods, heavy periods. Therefore, all of this can affect the quality of life. Now, how some sexual problems can be related to some serious disorders, and can sexual problems indicate that you are having some serious disorders or not? First, we'll discuss about the male. In case of male, erectile dysfunction, that is inability to achieve or maintain erection during sex, it is called erectile dysfunction. Unfortunately, many men who are suffering from ED, erectile dysfunction, they simply go to the medicine shop and they simply take Viagra. See, if you are taking Viagra, there is no harm. It can simply cure your erectile dysfunction. But the underlying cause of erectile dysfunction will not be diagnosed. That is, if the erectile dysfunction is because of heart disease or cancer, it will continue. Therefore, you will lose the opportunity to diagnose the cause. In fact, erectile dysfunction, I will say it's a blessing, because if you are having erectile dysfunction, it indicates that your heart is not working well. Therefore, you need to take care of your heart. This is the right time. On the other hand, if you are taking Viagra, your erectile dysfunction may be cured temporarily, but your cardiac problems may be continue and it can turn serious within next 3 to 5 years. Therefore, remember, erectile dysfunction is a risk factor for cardiac disease. You need to take care of your health by losing weight, by taking care of diet and exercise, and stopping smoking and reducing the alcohol intake, and doing exercise and avoiding the sedentary lifestyle. That is, you should not sit for a prolonged period of time. On the other hand, erectile dysfunction can be of some serious disease like diabetes, because sometimes we get to see the men who are coming to us with erectile dysfunction, and then we get to see the blood sugar level is enormously, significantly high. Again, erectile dysfunction can be because of some hormonal disorders like hypogonadism, testosterone deficiency, and erectile dysfunction can indicate some other disease, some neurological disease, some other nutritional problems as well. Therefore, erectile dysfunction should be taken seriously. Next, if a man is having problem with low libido, that is low desire in sex, it may not always be because of stress. It may be because of testosterone deficiency, it may be because of diabetes. Therefore, we need to take care of these problems seriously. Next, if you are having premature ejaculation may be because of thyroid disease, it may be because of prostate problems. Therefore, if you are not giving proper importance to premature ejaculation, it can cause the underlying disease to progress. Therefore, your prostate problem may become serious and your thyroid problem may be undetected. On the other hand, sometimes there are some men who are suffering from delayed ejaculation or difficult ejaculation. It may be because of prostate problems. Therefore, if you are not giving proper importance to it, your prostate problems will continue. It can be because of some neurological disorders or spine problems. Therefore, we request you, if you are suffering from this delayed or absent ejaculation, please give due importance to it and please consult your doctor in time. Next, sometimes men are suffering from pain during sex or bleeding during sex. It may be because of some infection, sexually transmitted diseases. It may be because of some injury occurred during sex, or it may be simply phimosis, that is, inability to retract the foreskin of penis. This is called phimosis. And remember, if you are not consulting the doctor, you can have serious injury in penis during sex. it can affect your quality of life and permanently can damage the penis. Phimosis can be because of diabetes, and if phimosis is not treated, it can cause kidney damage and it can cause cancer sometimes, and it can increase the risk of infection, and this infection can sometimes be serious. Now, in case of female, dysmenorrhea, that is painful sex. Painful sex may simply be because of various problems. Therefore, if a woman complains of painful sex, we need to ask at what point there is pain. Is the pain at the time of entry, or is the pain when the penis is deep inside the vagina? If the pain is because of entry point, it may be because of some hormonal problems or vaginal dryness. That may be because of menopause. That may be because of some low AMH. That may be because of some hormonal imbalance like PCOS. That may be because of some infections like candidiasis, vulvovaginitis, or even herpes infection. Therefore, we need to take them seriously, and believe me, all of these can be treated permanently and permanent cure is possible. Now, if the pain is deep inside the vagina, it may be because of endometriosis. Today, we are not going to discuss in details about endometriosis. If you have any queries regarding endometriosis, please see our different videos on endometriosis. It may be because of some polyps or fibroids, and very rarely, painful sex may be ovarian tumor, and sometimes it may be a sign of ovarian cancer. Of course, it does not mean that all the time the painful sex is because of cancer, but if you are having painful sex, please take it seriously and talk to your doctor. Please don't suffer from it silently. Next, if a woman complains of low libido, low desire of sex, it should also be taken seriously. It can be because of some medicines, like particularly some psychiatric medicines. It may be because of menopause. It may indicate some impending menopause or low AMH, or it may be because of diabetes. It may of course be because of stress, but we need to take it seriously and we need to diagnose the cause. Next, some women complain of bleeding during or after sex, and it should also be taken seriously because bleeding during sex can be a sign of cancer. Of course, in most cases, bleeding during sex is not because of cancer. It may be simply something called polyp, or because of some ectropion, that is the cervix, the neck of the womb. There are some changes in the neck of the womb, and it can be treated and it is not cancerous. But we need to take it seriously if the woman complains of bleeding during sex. Therefore, if you are suffering from these sexual problems, don't take it casually, rather talk to your doctor. What we can do? We talk to both the partners. Therefore it's preferable if both the partners are coming together, and if it's important to have adequate support from the partner, then it can be taken. We need to take some history. We need to examine. Physical examination is important, and next we need to do some investigations depending on the cause. And believe me, most of the cases the sexual problems can be treated successfully and permanently. If there is infection, we need to give antibiotics, we need to do some tests, and we advise the couples to have sexual abstinence until the sexually transmitted infection is cured. If it is because of erectile dysfunction, it can be taken by drugs, but in 90% cases, medicines work well. If medicines do not work, then we can have some other therapy like vacuum therapy, or some injections can be taken in the penis. And last option is of course the penile implant. It's a type of surgery. If it is premature ejaculation, it can be treated by certain exercise called Kegel's exercise and certain other techniques like stop and start technique or squeeze technique. In our clinic, we are teaching our patients how to do these techniques. On the other hand, if it is because of ejaculatory dysfunction, it can also be treated by diagnosing the cause. But if it cannot be treated, and if you are planning for pregnancy, sometimes self-insemination is possible. That is, sometimes if sexual problems cannot be treated, But if the couple is looking for pregnancy, of course we can do IUI or IVF, but before doing IUI or IVF, what you can do at home, you can do self-insemination, that is collecting the sperms, and it can be put inside the vagina by yourself. And believe me, many of our patients who are having sexual dysfunctions and whose sexual problems could not be treated successfully, they conceive in this way. But that does not mean that you have to do it, because majority of the time you can have natural intercourse. The successful sex is possible if we are able to treat it successfully. If it is because of phimosis, it should ideally be treated by surgery, that is circumcision or prepucioplasty. If it is because of dysmenorrhea, remember, before taking any lubricants because of vaginal dryness, make sure that you are not planning for pregnancy, because most of the lubricants can damage the sperms. There are certain lubricants which are sperms friendly that can be used, or of course we can treat endometriosis, fibroid polyps. These things we can treat them successfully. If it is because of bleeding, of course we need to take care of the cause, and then depending on the cause we can treat them by medicines or by hormone therapy. Sometimes some low libido can be treated by hormone therapy. Sometimes surgery can be done for painful sex. Therefore, if you are suffering from sexual disorders, please remember, sexual disorder does not only affect your ability to become parent or your mental health or your pleasure. Sexual health can affect your quality of life. Please take care of them seriously. So if you have queries, please don't hesitate to contact us through Facebook or YouTube channel. Now, few questions we got. Mr. Pavitra Sinha appreciated it. Thank you very much. Anil Chagul, thank you very much. Shondip Srivastava, thank you very much. Faria Shanas Nipa is asking, আপনি বাংলাদেশে আবার কবে আসবেন? Possibly in November. হাসনা হেনা is asking, স্যার আমার হাজবেন্ডের অ্যাজোস্পার্মিয়া সব টেস্ট হয়েছে, এই সমস্যার জন্য ওষুধ দিয়েছে। অ্যাজোস্পার্মিয়া নিয়ে এই স্বল্প পরিসরে আলোচনা করা সম্ভব নয়। আমরা বলবো আমাদের অনেক ভিডিও আছে অ্যাজোস্পার্মিয়া নিয়ে, দয়া করে সেগুলো দেখুন, তারপরে যদি মনে হয় আমাদের সাথে যোগাযোগ করতে পারেন। মোহাম্মদ রফিকুল ইসলাম তিনি কিছু প্রশ্ন করেছেন। FSH বেশি, AMH কম আছে, লেফট সাইডের ব্লক, বাংলাদেশে একজন ডক্টর ম্যাডাম বলেছেন নোয়েগ ইন ওভারি। পিআরপি থেরাপিটা কিন্তু হচ্ছে খুব এক্সপেরিমেন্টাল। পিআরপি থেরাপি এখনো পর্যন্ত জানা যায়নি, অর্থাৎ এখন এটা পরীক্ষামূলক জায়গায় আছে, পিআরপির উপর নির্ভর করা ঠিক নয়। এক্ষেত্রে বেটার হচ্ছে এগ ডোনেশন করাটা হয়তো বেটার হবে। ACS Neha Singh says, sir, please make a live session related to Down syndrome and all tests related to it and consequence. Dear Mrs. Neha Singh, we already have a video on Down syndrome. Please search for our video on Down syndrome screening in our Facebook page or YouTube channel. You will find it. There are so many things, so many tests are discussed in the Down syndrome testing. Please have a look on it. পার্থ সারথী সিনহা ধন্যবাদ, পার্থ সারথী পাত্র ধন্যবাদ জানিয়েছেন, ধন্যবাদ। ফারিয়া সানাস নিপা লিখেছেন, ডিয়ার ডক্টর সুজয়, আই এম লিভিং ইন ঢাকা, বাংলাদেশ and want to consult with you regarding my illness. Have you any plan to come to Bangladesh in short time? It's not short time, it's in November. Please let me know your future plan. It's in November. We'll let you know. Please have contact with us in Facebook page or YouTube channel. We'll definitely let you know. Thank you very much.